If transportation is part of your daily program, it is important to remember that child safety seats, booster seats, and seat belts save lives, and it is the law. Children strive to be independent and enjoy taking risks. Another thing we can do toward injury prevention is to make sure we have a phone available. The necessary emergency numbers must be posted beside each phone. If you are using cellular phones, these numbers must be posted in each room. The list of numbers would include police, fire, ambulance, the Poison Control Center, plus the closest place for medical treatment. Now let's take a moment to talk about specific childhood injuries. Falls are the way most children are injured. Head injuries are associated with falls. A fall can also cause severe injuries to other parts of the body. There's a lot of concern about the height of a fall. When you just topple over or fall the length of your body, chances of severe head injuries or other injuries are very small, if almost non-existent. However, if a child has fallen from 4 or 5 feet, the potential is greater that their injuries will be more severe. The important thing for you to look for is whether or not the child is breathing or is unconscious. If they are not breathing or unconscious, call 911. Don't move the child. With a conscious child, watch for drowsiness, vomiting, dizziness, paleness, blood, or any other clear liquid running from the ears or the nose, and certainly unequal pupils. If any of these symptoms occur, call 911. If a child just injures his or her head without the loss of consciousness or the other symptoms I've mentioned, make sure you alert the child's parents of the injury and have them watch for these same symptoms that might occur later on. Scrapes and cuts are another type of childhood injury. We have to pay very close attention to these types of injuries because of the blood loss that can be involved. Anytime there is blood involved, you need to wear gloves. These should be found in your first aid kit at the center. You also want to keep a pair in your pocket, especially on the playground or on field trips. The treatment of scrapes and cuts is simple. Clean the area with soap and water. You're not allowed to use any antibiotic ointment unless it has been previously arranged in writing by the parents. After you have cleaned the wound, you want to cover it to protect it from infection. And of course, please notify the parents. Bumps are another form of common childhood injury. To treat a bump, use a cold compress for about 10 to 20 minutes over the area. If you want to use ice or plastic ice packs, you need to remember not to put them directly on the skin. Use a thin layer of cloth between the pack and the skin, which will prevent burning the child's skin. Fractures are the last type of injury we're going to be talking about. When a child is injured, you want to look for painful, deformed, or swollen areas on the arms or legs. These will be fairly obvious if there is a fracture. It's very important that you don't move the child. Just let the child stay exactly as they are. If you really are concerned that there is a possible fracture, you need to stabilize the area and get the help of the trained pediatric first aid worker in your facility. They have been trained in how to stabilize possible fractures. Next, we're going to talk about choking. First, we're going to define it, then we're going to talk about how to recognize when a child is actually choking. We'll also talk about how to prevent a child from choking. In defining choking, let's talk about the windpipe that goes down into the lungs. When a child is choking, air is kept from getting to the lungs because of the foreign object is located in the windpipe and the child cannot speak. It is important to help the child immediately. After 4 minutes of not getting any air into the lungs, this child will suffer brain damage. If it continues beyond 4 minutes, it is likely that the child will not survive. Let's look at the way to recognize a child who is choking. This way you'll know the appropriate time to call for the pediatric first aid worker who is going to be trained in clearing an obstructed airway. It is not an emergency when a child can actually breathe. It is not a life-threatening emergency if a child can speak, cry, or if a child has a strong cough. When a child can speak, cry, or still cough, the airway is still open and the child can breathe. Even though this is not a life-threatening situation, it is very important that you stay with and observe the child and get some assistance from the individual trained in pediatric first aid for choking. In these cases, when a child can speak, breathe, or cough but still has an obstruction, do not hit them on the back. This could actually drive the object further down into the airway, creating a full obstruction. Instead, encourage the child to cough. It is an emergency when the child cannot speak or cry. You need to call 911 and get the trained pediatric first aid staff there as soon as possible. There are many items that will cause airway obstruction. There are two primary groups, foods and household items. Foods identified as choking hazards are popcorn, nuts, peanut butter, hard candy, hot dogs, and raw carrots. Normally you see food or hot dogs and raw carrots in this shape. What we'd like to do is to take and cut them differently when we serve them to children. So if you cut them lengthwise and then cut them in small pieces from this section, rather than cutting them in small circles, which can easily block the airway. The same thing with carrots. If you cut carrots lengthwise, you create smaller pieces that are less risky as a choking object. Household items identified as choking hazards and cannot be accessible to children younger than 2 years are balloons, which are extremely bad at causing airway obstruction because children tend to inhale the balloon as they try to blow it up. Other potential choking hazards include coins, marbles, small toy, parts, pens, caps, buttons, batteries, and screws. All of these items can cause airway obstruction. You can obtain a choke tube commercially that can be used to determine if the item is possibly going to cause an airway obstruction. If you don't have a commercial choke tube, a toilet paper roll will work just as well. To test an object for potential choking, place it in the choke tube. If it fits into the tube with nothing sticking over the sides, then it's a hazard. As a general rule, if an object is smaller than the child's fist, it can be a choking hazard. These are just a few of the items. There are many, many more. Just about anything children can put into their mouth can cause an airway obstruction. Keep this in mind, especially when dealing with younger children who are putting everything they touch into their mouths. It is very important that when your children are eating, they are sitting down. You do not want them running around or walking around. Moving about while eating increases the likelihood of food not being chewed and swallowed properly. You also want to make sure older children are supervised when the younger children are eating. Older children might give the younger children food they could easily choke on. You never take an infant and lay them down flat with a bottle in their mouth. Remember, infants are not always able to roll over easily, so they could choke on the milk from the bottle you are giving them. You want to teach the children how to chew well. If they chew well, then they are not going to have any problems with these airway obstructions. An important fact to remember is that most injuries are preventable. Preparing the environment for children is a key to their safety. Take an active role as a staff member to remove a hazard when you observe it. Relying on someone else to correct a situation places children at risk. You are a vital part of the health and safety of the children in your care. In conclusion, remember each Oklahoma Child Care Center is required to have a staff member who is trained to administer first aid, including rescue breathing and choke-saving measures. Use this individual as a resource in your center. Furthermore, additional information can be obtained from the Oklahoma State Department of Health's Good Health Handbook. And please remember, prevention through supervision and training are the best ways to care for our children.
While most of the injuries you will encounter as a child care professional will be minor, there are other situations we all need to be aware of. This is Dr. John Stemke. He leads a team of health professionals at the emergency room at Children's Hospital here in Oklahoma City. Doctor, thanks so much for taking time to talk to us today about child abuse.
You bet, David. Good to be here.
Now, our audience is made up primarily of child care providers, so I'd like to start the discussion by talking about the procedures that someone needs to follow if child abuse is suspected.
Sure. And it is important for daycare workers, child health providers, child care providers to know their law and the procedures to follow in their locale and their state. Every state is slightly different, but there are common denominators of dealing with this. If a daycare worker truly suspects abuse and neglect, then they're obligated by law to report it to their appropriate authorities. That may be a child abuse hotline.